Today we're going to review the stimulation medication Menopur with my patient.
Hi, I'm Morgan, and I'm going to be going through fertility treatment.
So this is Menopur, and when you receive your box, it's going to be stored at room temperature. And when you're ready to use it, the first thing you're going to do is open up this big Menopur box. And inside of this box, you're going to see that you have 2 additional boxes. Okay? This box contains our vials of medication and liquid. And these are our Q Cap vial adapters that we're going to be using. Okay. So the first thing that I would want you to do, Morgan, is I would have you open up the Q Cap box and take out one of these Q Caps. Okay, I'm going to set that aside. Okay, Morgan, so upon opening up this box, you're going to see that there's a smaller box inside labeled Menopur as well. You're just going to open up this box, and inside you're going to see that you have 5 powdered vials with peach tops, and then you have 5 liquid vials as well labeled sodium chloride. Okay, the sodium chloride is just the liquid we're going to be using to dilute the powder, which is where all the medication is.
Okay.
So I think your provider said you're going to be using 2 powdered vials, right? That's your dose?
Yes, that's correct.
You have the potential to use 1 to 2 powdered vials for each dose. So Morgan's is 2, so we're going to go over 2 vials. So now that we took out both of your powdered vials, we took out the 1 liquid, our Q Cap, we need to find some additional supplies that came in that larger box as well, okay? So you're going to have a bag of 3 ml syringes, okay? And that bag's going to be labeled used to mix and draw up Menopur, okay? Then you need to find one more thing. You're going to have a bag of 27 gauge half-inch needles, and that bag's going to be labeled used to inject Menopur, okay? So that would be all my supplies for this. So the first thing that I want you to know is this liquid vial actually doesn't contain any medication at all. You're going to have leftover liquid that's just going to get discarded into the sharps container, so don't be alarmed, okay? It's just used to dilute the powder with some medication inside. So first thing you do is pop the safety cover off that liquid vial. Okay. Then you're going to clean the top of the rubber stopper with an alcohol swab. As that's drying, you're going to open up one of your Q Cap vial adapters, okay? So the Q Cap adapter is just going to click right on top of that vial. You'll either feel or hear it snap on when you push it on. Okay. Then you're going to open up your 3 ml syringe from the package. And for your dose, it's specified that you're going to be using 1 milliliter of liquid. So the first thing that you're going to do is you're going to pull back on the plunger of the syringe so that you have a milliliter of air inside the syringe, okay? Then I'm just going to attach the 3 ml syringe to the Q Cap vial adapter by screwing it on, okay? So it's nice and tight. Then I'm going to push on the plunger to dispense that milliliter of air into the vial now. Push that in there. Then I'm going to turn the vial and syringe all upside down together, and I'm going to pull back until I have a milliliter of the liquid inside of my syringe. After you draw up your 1 milliliter of the liquid, you're going to turn it right side up, and then you're just going to pop this little vial out from the Q Cap and syringe. So we're going to leave that Q Cap and syringe attached together. We're just going to pull the vial straight out. This gets discarded into the sharps container. From there, you're going to take one of your first powdered vials. You're going to pop the safety cover off of this one now. You're then going to take another alcohol swab, clean the top of this vial. Taking the same Q Cap and syringe, you're going to click it on top of the powdered vial now, okay? From there, you're just going to dispense the 1 milliliter of liquid into the powdered vial, okay? To mix it, you're going to pick it up between your hands, leaving the Q Cap and syringe attached, sitting on top. You're just going to roll it back and forth, okay? From there, you're going to turn the vial and syringe upside down together after all the powder's been dissolved, and you're going to pull back so you have that same 1 ml of liquid inside of the syringe, which would be everything that was inside of that vial, because we only used 1 milliliter of liquid, so we're only going to get 1 milliliter of liquid out. Okay, so now it's a medication. And turn it right side up. You're going to, once again, going to pop this vial straight out from the Q Cap and syringe, leaving them attached together. So then you would take your second powdered vial, because your dose was 2 powdered vials. Once again, you pop the safety cover off of that powdered vial. You're going to clean the top of the rubber stopper, again with an alcohol swab. Okay. That same Q cap and syringe with our 1 milliliter of medication inside, you're just going to click it on top of this vial now. You're going to dispense that milliliter of liquid into this powdered vial. And once again, you're going to pick it up in between your hands and roll it back and forth. And kind of just like you're warming up your hands. You're going to make sure that all the powder's been dissolved into the liquid. You're going to turn it upside down, and we're going to pull back again. And you're going to get that same 1 ml of liquid, but now we have double the strength of the medication inside of the syringe. Okay. From there, we're done with all our powdered vials. So at this point, we would untwist the syringe from the Q cap and vial, and that goes into the sharps. And from there, you're going to take your 27 gauge half-inch needle that was labeled on the bag for injecting Menopur. Then the 27 gauge half-inch needle just twists right onto the body of the syringe, okay? And from there, you're going to be ready to inject. So you're going to use your abdomen to inject. You're going to go 2 to 3 inches away from the belly button, either to the left, the right, or below. So anywhere in that U-shaped area, not going above the belly button, you're good to inject. Having a seat, okay, when you're ready, select your site. Then you're just going to clean the skin with an alcohol swab. Okay. Then you're going to carefully uncap the needle. You're going to pinch the skin up to create a pocket-like pouch for the needle to go into. Then you're just going to go straight in with the needle all the way in at 90 degrees. Push on the plunger to dispense your dose. Okay? You're just going to hold it there an extra 5 seconds to make sure you got everything. Remove the needle from your body, and that whole thing goes into the sharps container.